So it's.
Thank you. Well, welcome everybody. And as WHO always says, good morning, good evening, good afternoon. But I think most people watching are in the UK and it's early evening, but we certainly have some colleagues from the Americas who've just woken up. And we're especially grateful to French people who should be at aperitif time before their evening dinner. So we're very welcome to everybody. C3 Collaborating for Health, for people who don't know us, we're a UK-based charity, not-for-profit, working globally with the aim, the ambition of preventing chronic disease. And obesity is a very significant issue in the epidemic of chronic disease. And we, at the moment in C3, are working with a large EU-funded project on obesity and unemployment in southern England and northern France. And among our partners are ViF, Vivons en Forme, and Stephane Sibalo, who's one of the project directors for Aspire, our EU project, which is about adults, working age people with obesity. But he, with Vivons en Forme and Sandrine, have a long experience of a very successful program in child obesity. So for that reason, we're really delighted that they're here to share with all of us this evening the work they've done, which reaches two goals that many of us in public health struggle with. One is being able to reproduce to scale, and secondly, it is to demonstrate outcomes. And my understanding of the work that Sandrine and Stephane are about to share with us is they've been incredibly successful in both those areas. So we're delighted that you're with us this evening in Europe, and we're all waiting to hear the work that you've done and how you've done it. So over to Sandrine and Stephane now.
Thank you. Okay, so I'm going to share my screen.
Yes, please. And we will be recording and sharing the recording. So, and we will have time for questions at the end of the presentation.
So let's go. Hi everyone. Let's start to share on what we have done since 30 years in the ViF program. Let me introduce myself. I'm Stephane Sibalo, and I'm in charge of developing the Aspire project for Vivons en Forme in France. And I just let Sandrine to introduce herself.
Hi everyone, so I'm Sandrine Raffin, and I've been working and doing a lot of trial and errors, because Christine was stressing the fact that we start having really good results with the ViF program that we're going to present to you, but we did a lot of trial and errors before being able to develop the program we will present to you now. And I'm very specialized in social marketing, which is something that I discovered about 15 years ago, working with some English teams also in Australia, like Nadine Henley, but also in Canada, because you have to know that social marketing is not something that is very well studied in France. It really only started 3 or 4 years ago within the School for Public Health to study social marketing. But that's what we're doing in my company, besides working on CSR also, but focusing on behavior change.
So I think you want to know what is the ViF program. Yeah. What we know actually in France, that in the last 20 years, all people know and they have memorized all health messages about For example, you should eat 5 fruits or vegetables per day, or you should work a lot, or you should do in sport. But what is it really relevant is that there is year after years there is more and more obese children. So actually is multiplied by 4. And also there is a lot of overweight and obesities. People are suffering a lot of from overweight and obesities, and mainly on underprivileged family. So the challenge we have to face is how to make the fight against nutritional and social inequalities a success. And I'm going to share the example of Vivons Forme. This program was funded 30 years ago by 2 doctors in the city of Forme, Laventie. It was an experiment, and they have noticed some very good results on reducing weight on children and families. So the objective, the mission of ViF is to prevent childhood obesity in promoting healthier lifestyle. What does it mean? Is that, okay, you can ask people to do more sport, but what is it really important is for them to experiment. Doing sport increase my my weight and give me pleasure, so increase well-being. Encourage physical activity and improve food choice. It means that between two kind of dishes, I will take the one I love and also the one who helped me to be healthier. And as Sandrine is going to share with you just after my introduction, is about, in this program, we use all tools and design action on social marketing. The approach of ViF is to give and provide concrete solutions to local counselors and health prevention representatives in cities. It means that we design this action by relaying the objective of the National Health Prevention Plan in France, for sure. And what we do also is to prevent, by designing this solution, is to prevent childhood overweight and obesity. And what we have now, what we know actually, is that if we want to have a successful program, is that a city must be involved inside the program for a minimum of 5 years. You cannot have good impact and good change on population within the 5 years. How does it work? It works that in the French ecosystem, what we have seen is that we deliver message and experience for all for the family through different network. For example, in the market and supermarket, you can deliver a good message related to food consumption. In urbanism, for example, you will design your neighbor and promote going to school by walk, for example. In school canteen, you modify the portions, and you change and arrange all menu, for example. In after school, you can design some some beverage experimentation. For example, for children, they can drink water and have and test different kind of water. So this is the way how we act in ViF, is to at every in all cities with all different organizations, we will deliver a message directly to the family and help them to take to do the right choice. And to use that, we to deliver this message, we have designed, with the support of LinkUp, a social marketing plan.
So I will try to be very concrete, but as Stephane just told you, the program can be very locally implemented and embedded within the city structure, because it's the way the French cities are organized. Everything is gathered within not only the political structure, but the administration structure, the people who are working in order to make the city work. We can gather them, and it's gathered within the city structure, so we can work with all the different stakeholders that Stephane just stressed within the earlier slide. When we talk about social marketing design, it's social marketing, but it's also mixed up with, it's not only in terms of campaigning, it's not an advertising campaign. It's really more, again, very embedded locally with local actors who are already interacting with the population. And what we do, and this is very traditional in social marketing, is we start by studying, and this is very classical, studying the target groups, what you've done in the UK for some years with the Foresight report, for instance, the key factors of success, the different groups also that we want to target. Then a very important approach within our methodology is to work together and to involve the local actors. Of course, we're not going to involve the local actors in all the cities where we act, but we always start by working in inviting local actors, local players, the one we want to get involved, to interact with us. For instance, when we want to work with after school, leisure center, extracurricular activities, we have some groups with them, creative groups, where we are challenging the way that maybe we will be able to implement experiments for the children. So we build together for local players, defining a method to work on a very targeted theme. We don't try, and that's why we need 5 years, to say that we're going to address everything. We are addressing one theme after the other, and I will focus that in a minute. Then, once we have designed the approach, not only the messages, but the experiences we want the local actors to share with the children and their families, we test and learn, we optimize the system. Most of the time, we're testing our approach in 2 cities in order to see what can be optimized, what is not working, why is it too difficult maybe for some local actors to deliver what we want them to deliver, because we provide them with action sheets and things like that they're going to implement. But we want to make sure that they're going to feel at ease with it, because we're talking about food, physical activities, sleeping better, well-being, etc. We're not talking about health, so it's really health prevention. So we don't want, and we're working mainly with non-health experts, because it's really prevention, primary prevention. Once we have tested and optimized our tools and approach, then we're able to upscale the program, and the team of ViF are doing some training, and they are mobilizing the local players. And in the meantime, and that we've been within EPOD, that was the ancestor of ViF. We were not so good with assessment, and now I think we made some progress in assessing each time the different theme we're working on, and to see how it's working. and how it's really helping families changing some of their routines. We really try to work on the routines, what people are doing daily in their daily life. And it's not a non-medical approach, as I was stressing. And mainly because it's the easiest way to interact with children and families. It's not so much through school. Within the French system, it's very hard to work with teachers because they already have a big load of things to do with children. And when they approach nutrition, because French children already study a little bit nutrition, but it's more theoretical. And what we try to do is that something that is really, again, embedded in their everyday life, and especially targeting more deprived families and with propositions that are really adapted to what they're facing. And I will give you an example on portion size of the way we've been working recently on the theme, and that has been evaluated. So it's a long-lasting program, Stephane said so. It needs to be a minimum of 5 years, and luckily, since the cities that are involved and the teams that are involved within the different cities, they're very happy with what is provided because they've been evolving. By the way, after a while, they also enrich the program in telling us that sometimes they've been asking, for instance, for us to focus on certain themes that we didn't identify, because it's really, it's not only downstream, it's also upstream, getting some information and demands from the cities. And so in France right now, as you can see, it's a lot in the northern part of France, also because that's the region where we have more overweight and obese people. But there are also other cities, and now it's not so much on this map. There are more and more cities in the surrounding of Paris, where you also have in some districts, some areas where you have more deprived families. So the NGO that is running the program with Stephane is now also a lot developing the program around Paris. So each time we try through every year, it's on a yearly basis, because an action to be working well, it really takes time to implement it and to have the local actors really implementing the different experience we are proposing. So we've been working during the past years on food rhythm, portion size also, and I'll come back to that point in a minute. We've been working also on all of this comes from the literature. We know that obesity and sleep and children who are not sleeping enough, it's also something that is linked to overweight and obesity. We've been working on physical activity, as Stephane just said, and we have really a program that is targeting especially, and this is going to be more medical professional, which are what is the name in English? The women who are in charge of helping mothers when they're pregnant.
Midwife?
Excuse me?
Midwife.
Yes, midwives. So we've been working a lot with the midwives because they're very efficient in providing and interacting with the mothers, and especially the mothers are with their pairs. So they are exchanging together, and it has been really efficient to work on the 2 first 1,000 years of life, and especially when mothers or future mothers are interacting with the midwives, and then also with when the baby is born, it could be more medical professionals that are interacting, but the midwives are quite efficient to our experience. And of course, and you know that in France, we do have meals, school meals and canteen. It's very organized, and we've been also working there, not only to have a better or a more balanced meal, but also to work a lot on the way the meal is eaten, the interaction with the children, if we want them to taste, because a lot of children wouldn't eat the broccolis, for instance, or stuff like that. So we've been working with interaction with the staff who's serving the meals, because we realize that if you don't involve them, they're not going to be able to help children tasting things that they don't like and that they don't eat usually at home. So there is no magical bullet. It's a lot of interaction with the local actors, understanding what they're facing and understanding what families who are especially most of the time, less educated, facing socioeconomic situations that are more difficult. How can we really help them in what they're facing when they want to do good for the children, but they want to please them overall everything. So I'm going to go through this theme, the portion size topic, and to explain to you how we've been working on this to have a concrete example. So the local actors we've been involving, it's mainly extracurricular facilitators. We also work with the school canteen, and that's the way we were able to work on children and family, but also with the canteen staff, because then they also had an impact on children, not on families because they don't really meet, but the fact that the children were living some experience and different experience within the canteen, or this meal that is taken at school also had an impact on the family. And we've been really trying to link all those different actors in order to be efficient towards children and their families. So the behavioral objectives we've been working on was serving appropriate portions linked to the children age. Why was this important? Because a lot of the staff are not very trained staff in the French school system and canteen, and they don't know what is the serving size. So we've been seeing that most of the time they would give maybe too much, or they wouldn't know what to do when the child don't want to eat its plate, etc., or they would force the child, which is absolutely inefficient, etc., etc. So we've been working on the way it was served at school. We've been working, and as you can see, all the treats here on the left, we've been really addressing what families are meeting. Because when we talk about the right portion of spinach or broccoli or fish, it's of course something we need to address and to encourage them to go towards this kind of food. But what they meet in their families, like many other French children, is that they're eating often pizza and more often in deprived area than in others. They eat candies, sugary drinks. They drink much more sugary drinks in more deprived areas than in other places, chips, etc. So we've been also targeting and trying to have some interaction with the children and the families on the portion size of those specific products, and not only on portion size, but of frequency, of course, and trying to help parents and understand how they can adopt a better portion size, not only on the good things we want them to eat, but also on fries, nuggets, sausage, etc. Because we could see, and we have in France, there is and it's linked to public health, there is a sort of observatory study that really help us having the good knowledge of what, and I know you have that also in the UK, knowledge of what they're doing in terms of their food habits, and why we had to focus on this, because we know that they have too much meat, too much nuggets, not only eating them too frequently, but when they do eat them, it's larger portion. So we've been and through the literature, and we started also, as I was telling, with 2 focus groups in 2 cities, Valenciennes and Évreux, but also studying the literature. And we could see that, and all of this, you know, because I think it's really everywhere. Huh? They eat much fewer vegetables than other children. They have a poor level of physical activity. They spend a lot of time in front of screen, etc. But what was more interesting when talking about portion size is that we could see that with a recent study done by Nathalie Rigal, who's a researcher in psychology, that in households with where you have more deprived families, mothers, most of the time, when a children is craving for food, because not everyone has the same, and not every children has are very hungry. Some of them can be satisfied with less smaller portion. Others, and it's true also among more wealthy families or more educated families, but if you are in a more deprived families and the child is craving for food, the mothers would compensate, but not only compensate, give more because she doesn't want to stop eating. Whereas in more educated families, parents would say, okay, you had two loaves of bread with Nutella or whatever, chocolate, whatever, and that's enough. And then you're going to have something else. Whereas within more deprived families, when the child is craving more for food, the studies say it's getting more excitation by food. In more deprived families, the portion is bigger. So that's why we wanted to address the idea of portion. And of course, we also know that they compensate the lack of maybe holidays and nice homes and stuff like that by giving more indulging food. And the school staff I told you about, and what we have in France, but I guess it's also the case, even if the structure is different in the UK, we have 20 hours per week for extracurricular facilitators, meaning that you have the curricular activity within school, but in between the morning and the afternoon, they have about 2 hours. They also have a break in the morning, and they also have extracurricular activities after school. So that's why those facilitators, who are just people who are trained in order to interact with the children, but there's no curricular activity for them. That's why we've been building a lot on their mobilization and their implication on the program. So another topic, and as Stephane was saying at the introduction, we really try to have recreational experiences, and we work a lot on experiences because we've seen within the literature and all those years that if it's knowledge doesn't help alone changing the behavior, and especially among children. But if we make them with their pairs going through nice experiences, they will reproduce it, they will talk about it, they will remember it. So that's why we work through those more educational experiences. No injunction, of course, no stress. And we try, when we provide some guidelines with the parents, because it's difficult to interact with parents, but we do interact with canteen staff because we train them. What we do is always to try to give an answer, and I'll give you some example, to what they are facing, and not trying to make them go towards a too idealistic way of eating, because we know that it's going to take steps. No food stigmatization. So that's why, as you've seen, we've been working also on candies and nuggets, and building also on parent self-efficacy. And this is very important. We want the parents to get on board because they're going to be self-efficient, and because they think that we consider them as good parents and who wants to do well, and we're going to try, and we're trying, it's a tone of voice, it's the way of developing, of course, not too much words and visuals, etc. But it's a matter also of the way of sharing the messages. So and those are examples, and I will go quickly on that because you understand. But for instance, after the training provided to the school staff, the one that is providing the meals, we've been developing some posters, for instance. We had also some videos to train them, etc., in order to show them what is the right portion depending on the age of the child, and providing them also some hints, in order, for instance, when the child wants more bread? Is it an open box? They can have everything they want, but why would they have bread? And how not to say no, but how to maybe guide a little bit the interaction that the school staff within the canteen can have with children. And in the meanwhile, we also have talked to the parents in order for them not to feel that the children will not get enough, because sometimes when we have this kind of implementation, some parents may feel that the children will not get enough because they may come back home being hungry because they wouldn't eat the string beans, for instance. And so we're very careful about this type of things. I won't go all of these tools, but when we develop tools, they really help for training the trainers, training the staff that is going to interact with the children and with the families, or that are helping, but after an exchange, an emotional, we call it emotional experience. Of course, it's not dealing so much with experience, but when you experiment, you're really using your more emotional function, and we know and we have experienced that it's really much more efficient. We make also a lot of link between the fact that when children will discover new vegetable and fruit, to make them understand how they grow and to smell them. And we work a lot on taste development. And there are also some training that are focusing on taste, which are developed also by the NGO Vivons Forme. As you can see, for parents, we're giving them those tips and reference points, because a lot of time parents don't know what they should give to their children. And if we give them only the right portion of string beans and spinach and stuff like that, what they are facing, and we've seen that in some families in Évreux, and the two cities where we started, or we tested the process, some families are eating chips 6 days a week. So the idea, of course, is to try to make them mix chips with something else, but first to reduce the portion of chips, because if you don't reduce it, there is no place for anything else. So, and try to reduce frequency, of course. So again, an example, and it's a nudge when we work with those experiential, the playful experiences with the children on treats, for instance, was working on portion side. If you want to have some chips, it's only what you can put in your hand when you have an open hand, and if it's candy, you have to put in your fist. And with a child, smaller hand than mine, then maybe you can have an idea of portion. So it's this type of thing. Of course, we don't give only some hints on those topics on treats, but what I wanted to stress, because we work a lot on drinks, as Stephane was saying, because it's really a big issue, sugary drinks, and we try to reduce frequency and size, of course, because most of the time it's open bar for children within their family if they want to have sugary drinks. You can see the visual of what we gave to the parents. It's 12 pages, points of reference. We don't talk only about pizza, but as you can see, what is written is, my child, is he eating enough, what he should eat, or not enough? Because a lot of parents in the more deprived, we've seen that through the literature and the focus group, they feel that they fear that their child is going to be hungry. So they gave them some candies in their pockets, etc. And because they're always fearing that the children won't have enough, because their role as a good mother or as good parents is to feed them well, and feeding them well is providing quantity. What I'm going to share now, and after I will be pleased with Stephane to answer your question, is that the recent publication we've been publishing within BMC Public Health. And what we decided to do is to work with Emery Constant. He's not part of the program, but it was interesting for us because he's really a public health expert. So I've been working with the team of Vivons Forme and with him on the data that has been collected in 4 cities during 4 years. And what we wanted to see is try to measure the impact of the program in terms of BMI. The problem with BMI and the way it was linked to the intervention. The problem with BMI is we don't have so much now school nurse and school doctors. They've been reduced during the past 10 years by more than 70%. So we have very, very few school nurse and school doctors in France. And when we have them, they're working on, there is a compulsory visit for children age 6, but then they might not see a doctor again for the whole time they're going to be at school. So that was very much reduced. And within this study, which was published in 2020, we've been working in 4 towns, and those towns were really measuring the weight and the height of the children. So it's a cohort of 827 children and we've been following them for 4 years and just looking at the result between the first year that they enter the program and after 4 years. And during that time, the 3 themes that have been implemented in those cities was a lot of things of physical activity, not sports, physical activity during extracurricular activities, trying to make them move a lot, about half an hour to 1 hour a day, if it was possible. We've been working on school meals, what you've seen, portion and meals frequency. And we had the evaluation scheme that was done by school doctors. So the 3 themes, as you've seen earlier, all themes have been tested in living lab in cities, optimized before to be implemented. And we were providing a lot of roadmaps and training to the local facilitators in order to develop those extracurricular activities that are educational activities on those 3 topics. We had, of course, some interactive session with the facilitators, but themselves then, so it was really training the trainers, were implementing workshops, interactive sessions with the children, and sometimes also with the parents, because we also try to work on breakfasts, for instance, inviting the parents at school. So the result, and you're welcome to discover, so it's really a big summary of the study. We had in the first year about 20% of the children in 2011 who were overweight or obese, and after 5 years, this number dropped to 16% in those cities. And what we have to have in mind is that it's not just cities that are average cities, it's cities where there are more deprived families and more deprived surroundings. So that's why it makes this result as an interesting result. And if we go to more on looking at what happened is that some children who were obese, maybe not the very much obese one, but we've been looking at the Z-score, etc., doing all the statistics in order to validate the result. Some of them became overweight, and some overweight children, after the 4 years, became with a normal weight. So it's altogether 50% of the children who were overweight or obese at the start of the study lost weight, and you have the numbers here. And what we've been doing, and I didn't share here the more detailed result, is really looking at in the 4 cities, what was the difference between the city who implemented, which implemented the 3 teams, and because there was 2 cities who implemented the 3 teams, 1 city 2 themes, and 1 city only 1. And the difference was really linked to the number of extracurricular activities and interaction they had with the school facilitators and the whole school system, not only schools, city also, because you also have what the children are doing during their holidays when they don't leave the city, etc. But the cities who decided, because it's the cities themselves who are deciding what they want to do. I mean, the teams, the local team, they are deciding what they want to do. But when they were really implementing the 3 themes, that's where they had the highest result. So that's why Emery Constant, with whom we've been working, said that the number of children per trained facilitator, the fewer children, that's another result, the fewer children there were per trained facilitators, the more effective was the intervention. And and if we look at the literature, one key, and I guess you all have that in mind, and I think that what makes also this program a success is the fact that it's a long-lasting program, and that we don't try to address everything in a year or 2, because it takes already 1 year to start involving the local stakeholders. And after doing that, they are progressing in the time. So that's why it's really important to implement those approach on a long-lasting basis. And so that's what was published. And we're ready for your questions.
Well, and the questions are coming. So Stephane and Sandrine, thank you very much indeed. So I'm going to invite people to ask their own questions. And I think I have about 5 at the moment. I have some if we run out, but I'll give other people the chance first. So Orla, I think I can see, she asked a question first off around this, I think, really important, interesting thing that is core to your program about portion control. Orla,
Lovely.
ask your question.
Yeah, thanks very much, Christine. And just to say thank you to Sandrine and Stephanie as well for the presentations. Really, really insightful. My background, just so you understand the context of where I'm coming from. So I'm a public health nutritionist. I work for Public Health England. I'm head of marketing for the early years agenda, particularly around social marketing. So I look after the Change for Life and Start for Life programs here in the UK. So social marketing very close to my heart, obviously. Some of the things that we grapple, I've got a couple of questions actually, if I may, Christine, apologies, but I was interested in—
You're in first, so
thank you. I was interested in terms of portion size and the recommendations that you are using for portion size when you talk to families. I would be keen to understand how you've arrived at those figures and those recommendations, because that's a constant struggle between a recommendation and what might be a typical portion or serving size for children, particularly. And there were several other kind of points I wanted to understand as well, which was around giving advice to parents around cutting back on food for children. You mentioned, Stephanie, I think the fear that parents have got around their children going hungry. One of the things that we've seen in some of the advertising campaigns we've done, we've tried to talk about snacking. So we know those touch points for sugar and calories tend to be, things like sugary drinks tend to be snacking occasions and, highly processed fast foods. Trying to give that advice has been really challenging. We gave some advice around 100 calorie snacks and sticking to a certain amount of portions. Some people received it well, but we got a lot of negative feedback and quite a lot of backlash, particularly from those communities suffering from eating disorders. So how do you balance the advice that you're giving to parents on portion size and then being concerned about their child developing an eating disorder, or that being an acceptable way of doing things? I'd be interested to hear how you've managed. Thank you.
Yes.
Wow.
thanks, Orla.
A lot in there, sorry.
No, it's fine. It's really what we're facing. I think that one first thing, that's why we don't have so much some backlash or criticizing, etc., criticism from parents, etc., is that we never talk about overweight and obesity. And you have to have that the grounding of the program. It's first of all, the program is really locally implemented. Of course, it's a national program, but then it will also it's becoming the local program. If you go to Évreux, if you go to whatever cities in France, people would say they have the feeling it's a local program. So there is a feeling of proximity, of understanding of their local context. So that's the first point. And the branding of the program is Vivons en Forme, which is let's live well in I don't know how to translate that.
Let's live healthy.
Yeah, let's live healthy, but it doesn't have the word health, like the way, if you say health in France, santé, good health, people are thinking you're sick.
Yeah.
So it means let's live in good shape. Yeah, and that's so it's not related to overweight and obesity. So we never say that. We never say when we give some advice, it's always to be not fit in terms of weight, and we don't talk about calories. It's always just in order to be in good shape and health, all the benefits would be to be more able to study, to be healthier maybe altogether, but in the not linking food or other consumption of food to putting on weight. So that's the first point. The other point is that I think that one could say that when we talk about drinks, sugary drinks, etc., excuse me, we take for granted that the parents won't stop giving them. So what we try to do is try to tell them, okay, if that's something you, because most of the time they drink that at the meal, after school, sometimes at night. I mean, the consumption is really there. So what we try to do is just to with the children, when there's the interaction with them and when we address this on the leaflet for the parents, it's just to tell them why water is so good and why water should be the first choice, and then say that. And then if the pleasure, what it pleases your children, etc., is having a juice or we don't say sugary drinks, whatever sugary drinks, the right portion is this. Because otherwise we try, it's not always easy, but we try never to be stigmatizing or saying things that would be very bad about those choices, because otherwise they feel that they're not doing the right choice. And if they feel that they're not good parents because they're not doing the right choice, then they're not hearing you anymore. Because they cannot, it's not acceptable for them to think that they are not good parents. So they think that, okay, maybe for the one and a child can be a little bit overweight but they're not going to tell him don't drink it. So we try as much as we can to always come from the positive side and to show the positive side of eating differently and of mixing the choices. For instance, for the afternoon meal or when they have a snack, how to mix or to organize a snack that is going to give some strengths, good benefits, etc. But sometimes not taking out completely the products that we want them to get rid of, but we know they're not going to get rid of those products. So that's how we've been working. And on portion size, of course, what we have in terms of reference, of course, we work with nutritionists in terms to have the right portion size. But again, we try to show how the diversity and the colorful plate and mixing things would make people give their children more vitamin, but also taking, for instance, for granted the price of the product also, or the price to pay. How can you bring some vegetable when you have the habits of just putting some chips in the oven or something that is so easy, ready-made, and then if you start telling those people, for instance, lonely mothers who are so busy, and we have a lot of lonely mothers in more deprived areas, and to tell them to cook or to make them not to feel good if they don't cook. So we give them also some hints about canned vegetable, frozen vegetable, for instance. And well, it's a lot of small things, but I would say that the overall approach is never to stigmatize, to say that such and such food, which we know that it's not a good food, it's not a good food. We don't criticize their choice. We try to make them change what they give to the children and to make the children being willing to try something else and to have fun in having something else.
Thank you. That's, yeah, I was going to, let's see, just have
so
a quick...
I have lots of other questions, Orla, so I'm going to have to move on, but I'm sure we can carry on outside.
Yes, thank you.
So Natalie, we have two questions from Natalie, if you can run them together fairly quickly, and then if Michael's still around, I'll come to him after that. Natalie.
Yes, so my question was around the same theme, around portion size. How do you manage? I mean, you said you gave the parents some leaflets. Do you have them in a workshop as well with the children, or is that just maybe you answered the part of the question right after when you were talking about the extracurriculum? So I had another question about the 20 hours extracurriculum. Is that mandatory? or and do you reach the right target? That was my question.
Yes. First question about the parents. That's the difficult part, because if you invite children, parents to a workshop, the one from the deprived areas, they won't come because they don't want to feel that they're not, and they don't feel at ease, etc. So what we would try to do, for instance, is organize breakfast during, for instance, on Wednesday, children are not in some schools, because it depends on the cities, they're making the choice, etc. But it could be on Saturday morning, on Wednesday, we organize a breakfast, for instance, where parents are coming, they're invited, it's the free breakfast, and they have a choice, including, I'm going to say something awful, including Nutella, because it's easy to tell them, eat a fruit and don't drink just fruit juice, because the fruit is much better for you. But if you don't tell them how to portion the Nutella, we feel we are not doing the choice. And Nutella is something that I think France is the highest country in the world to eat eating Nutella. So we have this kind of approach, and showing sometimes the portion that could be sufficient, that the child won't be hungry. Of course, we try to foster whole wheat bread, but we also have a baguette, because French are very keen on their baguette, etc. So we're really mixing all the different options in order to exchange with the parents and try to exchange with them with the portion, and to hear them when they say, my child is always hungry. I don't know, he's always hungry, and I don't want him to feel hungry. And when he goes to school or he goes to the canteen, since he has vegetable, he comes home, he's very hungry. So I'm giving him chips, etc., because he doesn't have enough food. So it's the way of exchanging, but in a very positive way again. So that's about the parents, and that's why we have those leaflets, that through the children who are living an experience within their extracurricular activities, they come back with this at home, and they can show some of the experience they have met or they have done at school. But sometimes we don't reach at all the parents. But fortunately, even if you don't reach the parents, we've seen that we could have some good impact, because the children with their peers, they learn also a lot, because it's the group dynamics, and they spend a lot of time at school. So the extracurricular activities in the more deprived areas, most of the time, children are using those extracurricular activities, because you have to be a very free father or mother to be able to do things with the children beside the curricular activities. And so between during the mealtime, or also on Wednesday, for instance, could be also on holidays, etc. Those extracurricular activities are free of charge, and especially in all schools, because that's the way it works. And you have to pay for it if it's on Wednesday or Saturday, for instance, but it's very much subsidized in France, very highly subsidized. Yeah. So parents are paying very little when they are more deprived families. So we have the feeling we are really reaching out the good target. And we know also that some districts that are classified as more deprived areas, we have this kind of classification in France. So we know that we're targeting the children. And by the way, some of the things we're developing for children who are eating well, or in their families, because more educated people eat very well in France, this won't do anything to them, because they do it already well. Mm-hmm. So that's why we choose to target, even if the message are not appropriate for more educated people, the less educated people, or the more deprived people, or having less money.
Thank you very much, Sandrine.
So Michael asks a question about the history, really, of ViF. Michael, can you? I think we can hear you.
You can hear me. Can you see me?
No, not yet. But keep trying.
Try again.
Yeah.
Okay, I think you just have to make do with my voice then for the moment. So, hello, Stephane and Sandrine. Thanks very much. It was really good to sort of see how you've gone about this, particularly I think the kind of starting with where parents are rather than where you'd ideally like them to be, which is important kind of marketing point. I'm from a charity called Health Action Campaign. We're particularly interested in what countries can learn from one another. And I know that France was kind of at the forefront in terms of the APODE initiative. And that's had spin-offs in various other countries like YOG in the Netherlands. So I was interested in how far your approach is different from or builds on what APODE has been doing.
I was the co-founder of APODE with Jean-Michel Boris. So and you know exactly what you were saying. I think that from what, and I was with Dr. Jean-Michel Boris, who when the program in 2010 really started changing a little bit and changing in the way it was implemented. At the beginning, within the APODE program, it was the city structure, but we were just working on delivering messages. It was more communication. So what we've been doing with ViF and with the team who's running ViF and has been running ViF for the past 12 years, in fact, it's really through what I've learned in going to social marketing congress, to learning also through literature with Living Lab, collective impact, really training ourselves, myself, the team at Vivons, Forme, etc. It's starting showing, thinking about what we were doing right and what was not that efficient. So it's really the evolution of APODE and starting from changing the name, starting from, because APODE meant in French, together, let's prevent childhood obesity. And in seeing that, we were stigmatizing somehow the children that were already obese or overweight in more deprived areas. So we changed the branding to Vivons Forme, let's live in good shape, etc. And we really were reaching out to involve local stakeholders, not only in delivering messages, but delivering experiences, workshop with children, in doing things, in making them cook, taste, move, do things. So it's much more through experience, but also thinking and exchanging with their peers, etc. That really has changed during the past 12 years from what we've read, from what we've seen, and from the immersion of social marketing that I had the chance to do back in 2017, 2007, thanks to, by the way, Boyce Swinburne really helped me with Nadine Henley, understanding more what was social marketing. And since I have a marketing background, from there, we started really evolving and looking at the literature, trying to be more efficient.
Thank you. And sadly, we still have one question, but I'm conscious it's after 6. And my colleague Denise Stevens and Stephane are all part of the Aspire program, so we can perhaps take the question elsewhere, but she quite rightly says thank you for a great presentation, which it certainly was. And I think the questions coming show how interested and interesting everybody's found it. So thank you very much indeed. I think there are a number of people who will be in contact with yourselves or with us about the Aspire program as well. And thank you, Stephane, very much, and for Sandrine for coming this evening. Have a good evening. I'm sorry you don't have our sunshine. And thank you all who come along this evening or this morning, for people who are in North America. And good evening, good afternoon, good day. And thank you all very much indeed. Thank you.